Hello, Mike Colson from Medicare Insurance Counselors here. We're going to delve into Medicare Advantage plans in this video. In my book, in my ebook, I mentioned that there's two difficult parts if you really want to understand Medicare and your insurance options. There's two very difficult parts. The first one is we've already covered in earlier videos, and that is Part D. Part D is very, very difficult to grasp and understand and get to the bottom of how it works and what you have to do to make it work to your benefit. And the second one, of course, is the current subject, Medicare Advantage. Medicare Advantage began a number of years ago, and what it is an option. It's a second way to access your Medicare benefits. The old traditional way, the original way, hence the term original Medicare, was for Medicare A and B. A is hospitalization, B, inpatient hospitalization, and B, Medicare Part B, is the medical part of your insurance. That means the doctor, lab work, x-rays, therapy, ambulance, anything that's received on an outpatient basis. So Medicare A and B is what has always been referred to as original Medicare. That's the old traditional way that people have accessed their Medicare benefits. And someone that has original Medicare as their primary insurance, most times, usually, probably 95% of the time, would add a Medicare supplement insurance to pick up the gaps that Medicare doesn't pay, and then that person would also add, more than likely, a Part D prescription plan which rounds out their coverage. Now, Medicare Advantage replaces Medicare A and B. I want you to underline the word replaces, and I mean that in a very literal sense. Medicare Advantage replaces Medicare. So what's happening here is instead of Medicare paying on your hospital and medical claims directly, instead of that, they hand a very large lump of money to an insurance company each month with your name on it. That number ranges from between $800 a month and $1,000 a month. So very, very round numbers. We're talking about $10,000 a year that Medicare hands to an insurance company with your name on it if you choose a Medicare Advantage plan. Now, the Advantage plan then takes that premium. They offer you an array of benefits, and now you get an ID card in the mail from that company that you may have chosen. That company's plan is not a supplement to Medicare. It's your insurance. So now instead of having three ID cards, again, the old traditional way where Medicare was your primary insurance, you'd have your Medicare card first, you'd have a Medicare supplement card secondarily, and then you'd have a Part D prescription ID card thirdly for your prescriptions. So you have three separate insurances. With Medicare Advantage, you have one card from one insurer for all three. So when I say that Advantage replaces Medicare, I mean it in a very real sense. Now, the first advantage, of course, is that it's an all-in-one plan. The second advantage is that you're going to save premium. Generally speaking, Medicare Advantage plans, from the standpoint of premium, as compared to having a Medicare supplement insurance, you're going to save premium. You're going to save $100 a month. You'll save $50 a month. You'll probably save even as much as $150 a month in the form of premium. Now, like all things in life, there are also disadvantages with Advantage plans. I know that sounds odd, but nonetheless, there are definitely some disadvantages with Advantage plans. First of all, you're going to be inside of a managed care plan. The bulk of Advantage plans are either HMO, which is a health maintenance organization, or it's a PPO, which is a preferred provider organization. Both of those together are referred to as managed care. Now, managed care plans have networks. You either have to use the network providers with an HMO, or you are encouraged to use network providers with a PPO. The PPO does give you the option to use out-of-network providers in exchange for a higher premium. But the point I want to make here is that there are disadvantages that come with the Advantage plans. They are network-based plans, they are managed care plans. You quite often need to have company approval to get certain procedures done, certain elective surgeries or MRIs or just whatever else your doctor may deem necessary. Company has to approve it. And they do say no sometimes. So that's why they use the term managed care. When you do it the other way and you have Medicare as your primary insurance, original Medicare plus a supplement, those are not network-based plans. Though that's not managed care. You're free to do anything and go to any healthcare provider so long as they work with Medicare. But you have much more freedom of choice using that method. And that little phrase comes to mind, you get what you pay for. With a Medicare Advantage plan, you save premium, and that is absolutely not arguable. You absolutely will save premium. With the Medicare supplement, you're going to pay more in premium, and it's my opinion, take it for what it's worth, that you get more. You get more in the form of it not being a network-based plan. You get more in the sense that it's not managed care. You just have more freedom of choice. Just a few numbers, just so that you can get a little bit better feeling what's going on here. Medicare Advantage plans, there's slightly a higher percentage of seniors that are enrolled in Medicare Advantage plans as compared to those that have Medicare and a supplement. The numbers, roughly, I don't have exact numbers, and of course it doesn't really matter, but just so you can get an idea, there's about between 14 and 15 million people that have Advantage plans in our country versus 12 to 13,000, 12 to 13 million, that have Medicare and a supplement. So Advantage plans are the slight leader in terms of numbers. So this actually concludes this little video. I hope it has been helpful to you. These concepts that I've just mentioned here are explained in much greater detail in my ebook, Imagine Understanding Your Medicare Insurance Options. You may already have a copy of that ebook. If you do, Advantage is discussed at great detail in Chapter 5. And so you may want to refer to that for additional information. If you don't have the book, the ebook, it is available in the Amazon Kindle bookstore. It retails for $4.99. The name of the book is Imagine Understanding Your Medicare Insurance Options by Mike Colson. We hope you have enjoyed this video. Thank you for joining us.